Junel is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Junel can also help make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using Junel does not protect you or your partner against sexually transmitted diseases. When taking Junel, it's important to follow the prescribed dosage and take it at the same time each day for maximum effectiveness. It's typically best to take Junel at the same time every day, so setting a daily reminder can help you remember. Before starting with Junel, make sure to carefully read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. It is important to take the pill at the same time each day, so choose a time that is easy for you to remember. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. Follow the manufacturer's directions for your specific brand. It is crucial to continue taking this medication exactly as prescribed by your doctor. With certain brands, the amount of estrogen and progestin in each active tablet will vary at different times in the cycle, so it's important to follow the package instructions and take the pills in the correct order. Do not skip any doses, as this increases the risk of pregnancy. If vomiting or diarrhea occurs, it can affect the effectiveness of the birth control pills. In such cases, you may need to use a backup birth control method. Consult the patient information leaflet or your doctor for more details. Taking this medication after your evening meal or at bedtime may help if you experience stomach upset or nausea. You may also choose to take it at another time of day that is easier for you to remember, but always take it at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication and may also have 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row. If you are using a pack with 28 tablets, take an inactive pill once daily for 7 days after the last active pill. If you are using a pack with 21 tablets, do not take any tablets for 7 days. You should have your period during the 4th week of the cycle. If this is your first time using this medication and you are not switching from another form of hormonal birth control, take the first tablet on the first Sunday following the start of your menstrual period, or on the first day of your period. For the first cycle of use, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy. If you are switching from another form of hormonal birth control, consult your doctor or pharmacist for specific instructions. Possible side effects of Junel include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, weight change, vaginal bleeding between periods, missed/irregular periods, high blood pressure, lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing eyes/skin, and serious problems from blood clots. It is important to contact your doctor if you experience any of these side effects. If you notice any symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Remember to check your blood pressure regularly while taking this medication, and always contact your doctor if you have any concerns or questions. If you are over 35 years old and smoke cigarettes or use tobacco, do not use Junel. This is because smoking can increase your risk of stroke, heart attack, blood clots, and high blood pressure when taking hormonal birth control. The risk of these serious issues increases with age and the amount of cigarettes you smoke. It is important to not smoke or use tobacco while taking Junel. Junel is a combination of female hormones used to prevent pregnancy. It contains 2 types of hormones, estrogen and progestin. Junel works by preventing the release of an egg during the menstrual cycle, as well as making the vaginal fluid thicker to help prevent sperm from reaching an egg. It is important to take Junel at the same time every day to ensure its effectiveness. It is typically taken once a day for 21 days, followed by 7 days of no medication or a placebo. It is important to follow the dosing schedule provided and to take the medication as directed. It is best to take Junel with food to help decrease stomach upset. Before taking Junel, it's important to talk to your doctor if you have any allergies to estrogens or progestins, as this medication may contain inactive ingredients that can cause allergic reactions. Also, discuss your medical history with your doctor, especially if you have a history of blood clots, high blood pressure, cancer, diabetes, heart problems, or liver disease. If you have diabetes, Junel may affect your blood sugar levels, so be sure to monitor them regularly and inform your doctor of any changes. If you have diabetes or phenylketonuria, be cautious with chewable tablets that may contain sugar and/or aspartame. It's also important to inform your doctor if you will be having surgery or will be confined to a bed or chair for a long time, as this may increase your risk of blood clots. Additionally, be mindful of sun exposure while taking Junel, as it may cause dark areas on your face and skin. If you wear contact lenses, be aware that Junel may cause vision problems. And if you plan on becoming pregnant, consult your doctor, as it may take longer to conceive after stopping Junel. Lastly, Junel should not be used during pregnancy, and it may decrease breast milk production, so be sure to discuss with your doctor if you are breastfeeding. It's important to be aware of any potential interactions with other medications that may change how Junel works or increase your risk for serious side effects. Some products that may interact with Junel include aromatase inhibitors, fezolinetant, ospemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, there are some drugs that may cause hormonal birth control to work less effectively, potentially resulting in pregnancy. These drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs, among others. It's important to inform your doctor when starting any new medication and discuss if you should use additional reliable birth control. If you experience any new spotting or breakthrough bleeding, it's important to consult with your doctor, as these may be signs that your birth control is not working effectively. It's also worth noting that Junel may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are using this medication. If someone has taken too much Junel and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact your local poison control center right away. In the U.S., you can call the Poison Control Center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important to seek immediate medical attention if you or someone else experiences these symptoms after taking Junel. It's important not to share Junel with others. While taking Junel, it's important to have regular physical exams and medical tests, such as blood pressure checks, breast exams, pelvic exams, and pap smears. Follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments. If you need more details, consult your doctor. If you miss a dose of Junel, refer to the product package for instructions on what to do. It may be necessary to use a backup form of birth control, like condoms or spermicide, to avoid getting pregnant. If you have any questions, talk to your doctor or pharmacist. If you frequently forget to take your pills on time, it's important to speak to your doctor about possibly switching to a different type of birth control. It's important to store Junel at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and out of reach of children and pets. Don't flush Junel down the toilet or pour it into a drain unless you're instructed to do so. When it's expired or no longer needed, be sure to properly discard it by consulting with your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.